Secretary Greenlee is the head of the Office of Class in the Administration on Aging. She's tasked with designing and implementing the class program for which we advocated so successfully for. And if that wasn't enough, she continues her leadership of the Older Americans Act program that many of us administer currently in our communities. Those of us who had the privilege of hearing her speak at our 2009 annual meeting in Chicago knows that she brings years of experience and dedication serving the aging. We're honored and humbled and thank Assistant Secretary Greenlee for taking the time from her busy schedule to speak with us about class and the Older Americans Act. LeadingAge family, please welcome Ms. Kathy Greenlee.
Good morning. Well, if I wasn't awake, I will be. Those lights are kind of amazing. It's good to be with you again. The Kansas folks are around somewhere. Hi. They had sunflowers when we were in Chicago. I remember Chicago. I assume most of you here today were at the Chicago event. It was memorable for several reasons. First of all, I had been asked to represent the First Lady in Chicago, which I thought was cool and stressful both at the same time. I think it was the largest audience I'd ever spoken to, and certainly I'm comfortable, and I've done public speaking a long time. And the most enormous stage. Do you remember that room? I wanted to share with you that as I was walking, I think, to a podium much like this, across that whole stage, I had one thought in mind: don't fall down. I mean, it was just a huge opportunity and a nice chance to introduce myself, and I got wonderful comments back from you, as I have like the entire 2 years now that I've been as Assistant Secretary. I don't know where Larry is this morning. He's somewhere. I just want to give a shout out to Larry and thank you all. He's over in the, well, you're under the lights. Hi, Larry. Larry and I end up seeing each other quite a lot. We're at the Aegis conference a couple weeks ago down in Dallas. And I want to applaud your advocacy as an organization and Larry's leadership for what you all do. I had the opportunity to meet Larry when I was still in Kansas, and it's been wonderful to come to Washington and see how thoroughly you're engaged in all of the various issues that impact people as they age. Seniors in particular, their caregivers, people with disabilities, kind of the whole range. So it's wonderful to be back with you today. I was especially glad I could join you at this this session, which is the Advocacy Caucus and General Session. That's the right place for me, the Advocacy Caucus. People ask me, and I certainly have been interviewed in the media and other places since coming to Washington, why did you get interested in the field of aging? Why did you do this work? I'm a lawyer by training. I'm not a gerontologist or geriatrician. I'm an advocate, and I tell people often I'm an old legal aid lawyer. The advocacy position for me in Kansas was the head of the Department on Aging, where I could advocate on behalf of other individuals, and that's always been a nice fit. I also have, in the authority to implement and oversee the Older Americans Act, the statutory responsibility to advocate. And what a wonderful, visionary act the Older Americans Act is. It says in the Older Americans Act at least a half a dozen times that both the Assistant Secretary and the agency itself is supposed to serve as an effective and visible advocate on behalf of older Americans. And I find this to be a wonderful mission. There are some opportunities for us all, and I know you're going up to the Hill, and I wanted to talk about my priorities for this year, the kinds of things that we're focused on most specifically at the Administration on Aging. And one is the reauthorization of the Older Americans Act. It needs to be reauthorized every 5 years. 2011 is the magic year this time. So I wanted to give you a little bit of background, and I will also talk about class because I know you're very interested in that topic. The Older Americans Act was passed in 1965. In fact, it was passed a couple of weeks before both Medicare and Medicaid were passed. But they really were passed as a triumvirate, the three of them together, to fill very, very different needs for seniors. Medicare, as you know, for the acute care for seniors. Medicaid, as you also know, which has become the primary funder for long-term services in addition to people's own private resources. And the Older Americans Act. The Older Americans Act was always designed to be fundamentally different. One, it's not an entitlement program. The differences in the size between Medicare and Medicaid and the Older Americans Act reflect that fundamental goal and difference. The Older Americans Act was always designed to be person-centered, and I believe was visionary in the fact that it was one of the first home and community-based services that we had in this country. And it was always targeted and has always achieved this target of providing support and independence to the nation's most vulnerable older Americans, people who are at risk for nursing home admission, at risk for Medicaid spin-down, and frail with multiple chronic conditions, people who are rural, people of color. It was always designed to be person-centered. And unlike Medicare and Medicaid, when you qualify for Medicare or Medicaid, you get the whole bundle. You get everything Medicare offers, everything that Medicaid may offer is designed in your state. But not with the Older Americans Act. You get what you need right then. And we fondly point out that we have always done house calls. We've always come out to an individual's home to do an assessment to find out what do you need right now. And because of that, we've been able to be cost-effective and efficient in delivering services. This was a visionary law. And the Older Americans Act reauthorization in 2011 is pivotal. One, I think we never realized as a nation the potential of this law, that it was really meant to help us avoid the costs for the other two programs, avoid the costs for Medicare and Medicaid, help support individuals as they stay in their community and age in place. It was always the goal. But if you look at the differences in the size of the budgets, you'll see as a nation that we never really changed our investment in the Older Americans Act from when it was first adopted. And in 2011, as the boomers start to turn 65, we have, I think, 10 or 15 years, so it doesn't have to happen like tomorrow, but we certainly have 10 or 15 years before the first wave of the boomers become really frail, where our services are most likely to be needed. And so this is a pivotal time for us to talk to lawmakers about the goals of the law, what it can do to help us all support individuals as they age. And the beauty is that we can make a decision this year and make another decision next year and help an individual as to become increasingly more dependent upon supports and provide those supports as we go. We will be engaged with the administration, with Congress, talking specifically about what we can do. And I think there are a couple of things, and I did a national listening session last year to get input. We've received input from hundreds of people about the Older Americans Act. And what we most want is to be innovative and progressive and provide flexibility to states so that they can tailor this program to meet the individual needs of seniors. Now, you all come from states, and you know what's happening with state budgets. And as you do your education and outreach, it's important to know that if you are looking at Medicaid in your state and what your state is doing to try to find cost savings in Medicaid, to change the state's financial obligation to Medicaid. Once a state begins to look at Medicaid, they've already looked at the other types of state supports that support the Older Americans Act. And I had a good meeting when I first started with the CMS leadership because we're all at the federal level looking at what's happening with the states. Many states have always supported additional state funding for programs much like the Older Americans Act as a Senior Care Act in Kansas. Those supports are gone. Those supports are the ones that state policymakers decide to trim well before they get to Medicaid. So supporting this program on the national level is very, very important, as is engagement at the state level to continue to talk about the critical role that these supports have to help people stay independent. And it can be so much less expensive to provide supports in this way. So we will be working on the Older Americans Act reauthorization this year as a key priority, and I look forward to working with you, and I know you all have a commitment to helping us get the law reauthorized.